Someone asked me about the oxidative process, and I want to throw in the ionization process, and I'm going to give you a little more of an intellectual jargon on this. Not today. I don't only have about 25 minutes, but I'll get to your question, and I'll show you a little bit more in depth of the body that way. But not needed, because there isn't one person you're going to sit there and talk to them about that. As long as you understand oxidation, the catabolic anabolic process, it's duality at its finest. Duality dictates acid and base. Catabolic anabolic, breaking down, building up. Anionic, coagulation, stagnation, dehydration, and cationic, which is rehydration and activity. So you see the swinging between these two poles of duality in chemistry. You see it in physics. You see it in all sciences related to creation. Outside of creation, there isn't the duality, because there's the one. And that's what we were talking about yesterday. As you move away from the physical world, you move away from the more mundane bodies, the more inert levels of creation, the more one things become. The further away from God you have expression, the more things seem individual and separate. So it's just the way life is, but it's the way the drama has to play out, because without individual separations, I wouldn't be able to drink this orange juice. Let me see. She is now focused on her weight and wants to try this new diet where they give you HCG injections so your hunger is suppressed, and they put you on a 500 calorie per day diet. What are your thoughts? What are my thoughts on HCG injections? I don't think you have to ask. I don't think you have to ask about that. I think that the best way to do it is change your lifestyle and get hooked on raw foods. Whether you have 100 raw foodists is not important. If you push sometimes people to become 100% raw foodists, they'll leave. You do it for yourself and excite them to power up that way. But as a practitioner, don't expect all your clients to do it. If you do, you want to aim that way, you want to push them that way, your job is a way shower. And you want to keep pulling them to more raw, more fruits, berries, and melons, absolutely. But you can't hang them over with a sledgehammer and then judge them because they didn't do it. You wouldn't make a good healer that way. You want to have love and expression, because you understand we all struggle with these things, especially the older you are and the more conditioned thinking and things like that. The younger you are, the more energetic, the more focused, the more adventuresome, all these things. And if you're born from raw food parents, I can't tell you how lucky you are. I just can't begin to tell you. I only pray that I could be born from raw food parents who were born from raw food parents, and we kept going down that line, because we wouldn't be where we are. But that's, I guess, why we're talking. But raw food diet is the only true way to lose weight. Now, remember, there are going to be some, and you guys didn't ask me this question, there are going to be some that actually gain weight. I was filling out a protocol for this young lady. She's 5'8", 306 pounds. Now, it's possible because of the high acidosis, and this case had a tremendous amount of boils. This case had tremendous amount of lymph problems from day one. Lost her tonsils at 6. You can see just for what she's describing about herself, the tremendous problems that she's been having. Cysts and boils all over the place. Heavy lymphatic problems. Well, the only way is to get on these programs. She might gain a little weight when you start detoxifying these people, because she's so acidic, the body's going to hold water. Remember, you can get a little more edemic in an acidic environment. That's where you see all the congestive heart failures, the pulmonary edemas. You see all the swelling of the ankles. You see swelling during menses. Women always see swelling during menses, bloating, because estrogen is an acidic steroid. So the more acid you see building up in the body, the more the body must protect itself against this, the acid side of chemistry. So edema, swelling, this is just one of the side effects, the hypertrophies, the enlargements, because it's the body protecting itself. Remember, it brings in cholesterol, it takes calcium, anything to fight acids, because remember, when acids win, you lose. And we're not going to lose to acids, are we? No. So, HCG. tell her physician to give themselves that shot. Now, let me see. This is Bryant. I need your help to find the correct direction for my son, which is having some health issues related to extreme autism developed at age 17. Look at that. Hearing voices, insomnia, unwilling to drink enough water, IBS, inability to hold stool or urine sometimes, copper and heavy metal toxicity. I have a book by Norman Walker, good book, which has some recommendation related to spinach juice and also carrot, among other things. You know, I can only tell you that carrot juice was the fad back then, but a very bad detoxifier. And I've talked to you about that in my own case, Dr. Jensen's case. And carrot juice doesn't have near the power. Matter of fact, of the veggies, it's probably the least powerful. Greens are much more powerful at detoxifying. Wheatgrass is far better to detoxify the body than carrot juice. And for carrots for the liver, I'd go beets. Much more powerful. I've done plenty of carrot juice fasts, many weeks of carrot juice fast, and I've done a 3-day beet juice fast that kicked my butt. So there's a big difference in what you use to fast with, and carrots is not really the one you want to deal with. This young man needs the fruits and berries and melons real bad, particularly the fruits and the berries. They're neurological. They're the endocrine gland, and this is really what you're going after. The neurological part of fruits strengthens the myelin sheath and strengthens the nervous system. At the same time, of course, you're working on the adrenals. At the same time, you want to pull out neurotoxins that this young man might have been subjected to, whether it's from vaccines or whatever source. It doesn't matter. Pop the fillings out of his mouth if he's got them and get composites. You want to do all those sort of things. I'd probably use upper circuit brain and nerve, particularly on this young man. Definitely head off in the kidneys, the adrenals, the GI tract. He's got IBS. So you know his lymph system is backed up all through him. And this is something you really want to go after, is this lymph system with him. And of course that adrenals. Here we go. Here's the autonomic nervous system you're dealing with here. And even reaches up into the CNS. And then of course you can go after the CNS, central nervous system, the brain, the hard drive. And you go after him in that way. And start getting this young man on the planet here. That'll clean up his bowels. So you want to definitely get into the GI tract again with the stomach and bowel formulas. I think probably you got insomnia and he's not holding his urine. I'm probably going to be up in the central nervous system again. I'm probably going to be pituitary involved. If he's not holding his urine well, you're going to find that involved in the pituitary stem. Could be no more local with the adrenals and the bladder and all that, but with the insomnia and the autism and all this, I'm probably going right up here in the head. That's why upper circulation, the new brain and nerve formula, I'd probably hit his pituitary 1 and 1. That's a glandular. If you really wanted to hit his pineal gland, I would do that too, with a little pineal, maybe glandular 2 at night before he goes to bed, that sort of thing. But you got to detox this young man's head. Well, remember, we've been talking a lot about the GI tract relationship to the head area. You must clean up the gut if you want to clean up the head. You're not going to drain the sinuses or the head if the gut is backed up, and this IBS is obviously leading you to that area as well. So you've got to clean up this IBS, which is really just another word for acidosis or interstitial lymphatic constipation. And that's what this young man's got, where you're going back to the kidneys and adrenals. Well, what do you got? Autism. So it's not only adrenals, there's too much of a central nervous system issue, in my opinion, in this young man as well. So you've got to get up there and head after this. This will be very important for this young man for so many reasons. And I'm sure he's not real happy about the urination problems. And it's just the pituitary problem there that needs. Copper loves the kidneys, so get that out of the kidneys there. Again, moving the heavy metals and probably neurotoxins as well. But detox, detox, detox. You could use some green drinks with this young man. Alfalfa sprouts, parsley obviously, beet juice, dandelion greens in season, spinach, anything like that, absolutely. And make a more powerful green drink. If you have to use a little carrot to buffer it, okay. Probably use a little apple as opposed to a little carrot. Carrot's just a starchy veggie, and nobody seems to be raising good carrots nowadays, including Bunny Love. I think Bunny Love carrots, those guys, they used to have best carrots sweet, and unless you get up into Canada, those carrots were killers. But I don't know, somebody's not taking care of soils or something. Betty Love carrots down here are very bitter. Need to know how to proceed to alleviate all my son's nervous tensions and fears. Your feedback is, I appreciate that. I need to know about juicing combinations for this. All right, got that. Cooked or raw or both. Animal protein, he is zero positive blood. I don't care what his blood is. Zero protein. Zero protein. With IBS and all this problem, you keep acidifying him, there's no way you're going to pull him out of it. So zero protein. Get your amino acids from where all the strongest animals do. The primates and the herbivores, all the horses and elephants and cows. These guys lead perfect examples of why meat eating is on the negative side. Look at the animals that are more meat eaters. They're more violent. They have less endurance. They sleep a lot. That sort of thing. So you just and they stink. They stink bad. So get him away from all proteins, real important. He is 6 foot tall, 145 pounds. So he's probably malabsorbed. He's 6 foot tall, could have been the pituitary again, popping him up there. Half Persian, half American. He was an honor student and an excellent athlete in track. He won lots of trophies until 6 years ago and almost died from antibiotics. Holy crap. Jesus. Yeah. More medical intervention, more medical. These guys need to be held accountable. We're not holding our people accountable when they hurt us. Hey, Latin, I'm just going to call you this beautiful woman Latin. I would like you to discuss high fat, even the healthy ones. I have many friends who give their kids avocados, coconut, and nuts, and one friend has a son who has had 2 heart surgeries, and he is only 9 months old. This young man's, this is my point. You see what's going on with the kids? Oh my God. A lot of kids are being born with holes in their hearts, blah, 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 blah. Well, tissues on the decay, and big time in the Homo sapien race, exacerbated by the allopathic thinking. And there's no way you can prove that any day of the week. Medical doctors do not want to pull us into court or their day's done. Their day's done because we have so much evidence against these guys, it's not even funny. This is unbelievable. 9 months old. Well, you got some regeneration to do on that young man. And at 9 months old, you can start slipping him some fruit juices, definitely some coconut milks and stuff like that. The high fat, you want fatty acids. That's what you're looking for, naturally found in avocados and natural foods. So I wouldn't even worry about the fats. I would look at the diet. And of course, this is not appropriate for 9 months probably right now, but Jennifer's fed her children at 9 months fruits and all kinds of things. So you can talk to her. She's more experienced with the children than I am in terms of having your own. I mean, I've had a couple of children, but these, and I've raised, like I said, my a younger son, fruitarian, but now somewhat difficult. But you do what you can on these. The children are just like anybody else. They're just little people, and they need the same diets. And particularly, you want to mature them up with the fruits and the berries. If you want to get into the salads, fine. Avocados, fine. Coconuts, fine. That sort of thing, fine. Think of yourself in a tropical setting and what that diet would be, and you'd be right on point there.